Hi guys, my name is Rishikesh Telang and today I'm going to be giving a TED talk on natural language processing and its applications over self-report scales in the medical or the healthcare domain. So as we all know that a self-report is any method that involves asking a participant about their feelings, attitudes, beliefs, etc. So, some of the examples of self reports are questionnaires and interviews. And self reports are often used to gain participants' responses in observational studies and experiments. In this video, I am going to be discussing about how the idea of self reports really work in NLP, how their applications are in various domains, what are the potential difficulties that are faced, especially when we are trying to analyze everything using NLP, and what we can do and what is the exact significance of self-report scales in the future. Now, in today's generation, uh, self-report scales is used for analyzing a person's particular mental state. So, for example, when a person is suffering from any sort of problem or any sort of medical health problem, usually they are always given a report, and in that report there will be certain questionnaires which they answer, and depending upon those answers they will be giving some sort of ratings. Now, where does natural language processing come into picture? Technically, what natural language processing does is it tries to analyze all the different characteristics, all the different keywords, all the different analysis which are made in the self-report scales, which also technically involves comments. And with the comments and the options which have been inputted by the user, it tries to look for what is really the problem, whether the patient is suffering from some pain or whether he is suffering from some kind of psychological illness or maybe some form of mental health problem. It could also be that natural language processing can be used to analyze what are the sentiments of that particular person, depending on the kind of words of expression which that participant has used while he was filling that survey form or whatever. So, in a lot of research, at least when I'm talking about the CDC, natural language processing is used for objectively quantifying words from open ended questions rather than the closed ended numerical rating scales traditionally used today. Importantly, the results suggest that these semantic measures have competitive or higher validity and reliability compared with traditional rating scales. With the help of these semantic measures also brings along advantages, including an empirical description of the measured constructs and better differentiation between similar constructs. A lot of these methods that are used in natural language processing encompasses a great potential in terms of improving the way we quantify and understand individual state of mind. Sometimes natural language processing can also be used for objectively quantifying all of those words and trying to analyze the sentiments of that particular person. Now, I'll be giving you certain applications where it is used. Now, when we want to know the impact of HIV and AIDS, which are sexually transmitted diseases, we are trying to analyze how a lot of these researchers have analyzed how these particular topics or these particular um, how these particular people have been medicated. Like sometimes they will be given a particular self-report form and they will be asking whether the particular patient uh, has been whether the particular person has been when the reports whether they have been 0% medicated, whether they have been 50% medicated, 75% medicated, or completely medicated. So with the responses that they receive, they know exactly whether the person is properly taking their treatments, or if in case they are not taking their treatments, they may probably try to make sure that they are given the right form of medication so that these people do not try to infect other people around them with those sexually transmitted diseases, because we know for sure that HIV and AIDS are chronic diseases and they stay with you for a long time. Another application of self-report scales is in the domain of social anxiety. Now, we all know that social anxiety is a universal phenomenon. When the level of anxiety, avoidance, and impairment in functioning reaches clinical proportions, the diagnosis of social anxiety disorder and possibly APD is made. Normally, the assessments for trying to analyze social anxiety typically involves social self-reports. So in self-reports, we're trying to look at different role-playing procedures, and we're looking at all the cognitive assessments, like for example, thought listening, information processing paradigms, and all of these other psychological based analysis is made by these users. Another thing that I have also seen is the application of using self-report scales to see the psychological effects of hearing impairment in older adults. So what happens is, when a person is not able to identify what are the different problems that are being faced by the user in terms of his hearing loss, he can definitely try to answer the questions related to it. Like for example, when a person is not able to hear certain frequencies um, in the range of probably 8,000 to 20,000 hertz, then it probably means that this person has medium hearing loss. And in case if it is lesser than a particular frequency of hearing, like for probably like 4,000 or 3,000 hertz, then that probably means that he has a more severe based hearing loss. So as we know that a normal human can hear frequencies between 20 hertz to 20,000 hertz, we're trying to, with the help of self-report scales and thankfully with the help of natural language processing, we can identify how these particular diagnosis can be made with the help of all of these things. The third application of self-reports is the primary means of measuring pain. In clinical settings, pain is assessed on a 0 to 10 numerical rating scale, with 0 indicating no pain and 10 indicating the worst pain imaginable. In research settings, a 0 to 100 visual analog scale is the most common measure for pain intensity. Among other adults, however, the verbal descriptor scale is recommended. Now, the verbal descriptor scale is another self-report scale. So what it usually does is, it tries to measure pain intensities using word anchors. And that, for example, is like no pain to worst pain imaginable, which I talked about in the previous discussion. It is a reliable and valid measure for pain intensity and is usually most preferred by older adults. And these are one of the many ways in which self-report scales are used. Now, I will be discussing about the disadvantages. Although self-report measures are easy to obtain and they are inexpensive, they are notoriously inflated and they're inaccurate unless a validated and reliable questionnaire is used. Like for example, it is possible that a particular person may give some sort of wrong inputs based on his mental state of mind. You don't really know what is going on in that person's mind at that given point in time, and that really is bad, and it proves disadvantages, because if in case the person is giving a wrong output or if he's giving wrong inputs, then natural language processing will obviously not be able to give the right diagnosis. Also, self-report studies have a lot of validity problems. Patients may exaggerate symptoms in order to make their situation seem worse, or they may underreport the severity or frequency of symptoms in order to maximize their problems. Sometimes patients may also simply be mistaken to misremember the material covered by the survey. Sometimes patients can also, try to take advantage of the situation by giving wrong inputs and then trying to take advantage in the healthcare domain. Maybe a person may not be depressed, but he may be misdiagnosed as depression because probably he wants to be given healthcare treatment for free, and maybe that could be for some other ailment which he is suffering from. So in my opinion, self-report scales is flawed in many ways, but it has a lot of different applications. And I believe personally that if we are able to couple self-report scales with different lie detection mechanisms, I am 110% sure that we will be able to ensure good progress in this particular domain. There are a lot of researchers which are actively working in the domain of self-report scales, and I know for sure that with the right treatment, they will be able to give the right they'll be able to give the right treatment to their patients. So thank you for listening to my TED talk, and I hope you have a wonderful day.